Hi friends, we are now talking about long COVID, also called long haul COVID, also called chronic COVID syndromes, also known as the post-acute sequelae of COVID in research. This is a condition that is becoming very common across the world because we've had 500 million plus infections of COVID in the past 2.5 years, and the numbers just keep growing. And when we talk about at least 11.5% of people who have had COVID, whether it be asymptomatic, mild, moderate or severe, developing long COVID, we are talking about a number that's in millions. So friends, this is Dr. Sitesh Roy, your super specialist in allergy, immunology and asthma, coming to you with this special on long COVID. Friends, what is long COVID? Long COVID basically means you're supposed to recover from a COVID infection in about 2 weeks completely. If you had a severe bout, maybe 4 weeks. If there are symptoms related to COVID that are going on beyond 1 month, then you're starting to have long COVID. If they are persistent in the second or third month, then definitely there's a diagnosis of long COVID. And in long COVID, the symptoms can be very many. There are literally 50 different symptoms, bodily symptoms, physical and mental, which have been associated with long COVID. So we will go head to toe. Obviously, the most common ones that people see are fatigue, just being tired, not being able to do their day-to-day routine activities that they used to do before very easily, and getting tired and having to take breaks or rest or having to take naps sometimes during the day even. And that kind of fatigue and tiredness and sometimes body pain and muscle aches is a part of long COVID long after the viral infection has been cleared from the body and the person does not have any signs of the infection. There are also some other very common symptoms that include having brain fog, not having a very clear mind, not being able to remember things very easily, do things as quickly and as fast as you would want to. You then look at some of the other symptoms. You can have headaches. Headaches can persist and go on for weeks and months after the infection in some people. You have obviously heard of people who have lost their taste and smell and it has not recovered even after 2 or 3 months. We have patients who've had loss of smell for over a year now after COVID, who had totally normal smell prior to COVID. When you go down the list, a very common problem that people face is hair fall after COVID, believe it or not. And people have lost a lot of hair sometimes in the post-COVID syndrome or sequelae. If you look further, you recognize that some people have a cough that just does not go away. And this cough is generally a dry cough, but can very rarely be a wet cough if they had some underlying lung conditions that were present prior to COVID. Along with this, some people have experienced breathlessness or shortness of breath. This was more common in the Delta variant and the Alpha and Beta variant, but is also sometimes seen in the Omicron variant. Interestingly, when we look at the numbers of people who are developing long COVID, with Delta, the numbers were higher. They were close to 11.5%, as I mentioned. With Omicron, the number is 4.5%, but Omicron is double as transmissible as Delta virus. So the number of people who are getting affected by Omicron is much higher. So when you take 4.5% of a much higher number of infected people, you still are left with a lot of people having long COVID syndrome and long COVID symptoms. Recognize that in some studies they have found long COVID symptoms in up to 40 or 50% of the population that was studied or investigated after they had recovered from their acute COVID symptoms. When we look further, some people have palpitations, a fast heart rate. Some people have palpitations, are also called tachycardia in the medical field. They can also have chest pains that can be present. Some people have abdominal pain, abdominal discomfort, loss of appetite. These can persist for long periods of time. The post-COVID fatigue that I mentioned earlier can become so severe that people can have a hard time even doing their day-to-day life activities and getting tired due to it. And if they do the slightest exercise, they get so fatigued that they then have to rest for days. Some people have what is called postural hypotension, which means if they go from lying down to sitting, sitting to standing, they can feel dizzy and they can even have falls due to it. So with all of these friends, as you can see, long COVID can affect the nervous system, long COVID can affect the respiratory system, long COVID can affect the cardiovascular system, long COVID can affect pretty much any system, the gastrointestinal system, the musculoskeletal system, the cutaneous system. So people have had recurrent hives, itchy rashes coming up on the body after COVID. As I mentioned, hair fall earlier. So again, the cutaneous system, the skin and hair system can get affected. So friends, please do everything you can to protect yourself. Take your vaccines, take your boosters if your doctors recommend it for you and it's right for you and the time is right. Do everything you can to boost your immunity with the right diet, lifestyle, exercise, good sleep at night. Do your prayers, your meditations if you believe in them, because all of these things will go a long way in keeping your immunity at its best and preventing long COVID, which is the best thing you can do, because once you develop it, treating it is not easy, though we as doctors are using a lot of different unique therapies and systems, including rehabilitation, to help these patients and seeing success. But it takes time. Have patience, stay safe, take care, look after yourself. Until the next time, God bless us all.